is on diabetic retinopathy. Very interesting case. We are Trancional mentor, and let's see what is better for a fresh diabetic retinopathy case, proliferative one, of course, after treatment with laser, and minimally invasive proliferative diabetic retinopathy with early Trancional Retinal Detachment. So the patient is a phakic one, starting here with a 23 gauge paraspinal vitrectomy. Patient has a clear lens despite some peripheral cataract, a mild one. The vitrectomy starts with removing these hyaloid asterites that you see all over the posterior pole, and right behind the hyaloid asterites you see the proliferative changes in the posterior pole from the diabetic retinopathy, and you see also some air bubbles that are just beneath the lens, so actually making the limit from the lens, between the lens and the posterior pole. You see laser all over retina using now a 25 gauge, as you see here, forceps. First, removing some hyaloid left. You see the hyaloid is very attached to the posterior pole, still some hyaloid asterites remaining. You've got these fibrous bands, hard exudates on the foveal area. And I'm removing here this band that you see here, the whole thing is attached to the macula. So by removing it, it's important to remove the scaffold that is just there, making the retina traction, and also making feasible for new vessels to grow. So as you see here, all the hyaloid is being removed around the optic nerve, the macular area, in the nasal side as well. It's very important to trim it all over to remove the maximum. You see there, this is a very powerful macular lens, as you see here, the retinal membranes over there in the fibrous tissue temporarily at the macular area. And now with the 25 gauge forceps that I've shown you some seconds ago, I'm removing the fibrous tissue, and you see some bleeding. This is a pre-retinal bleeding that you see from just there at the area of the new vessels and fibrous tissues. So the good thing is to remove as much as possible all these fibrous tissue up to the retinal periphery, avoiding the lens, of course. You don't want to create a cataract at this point of the surgery that could halt your visualization all over. And you see that the vessel is active, is actually bleeding. With this maneuver, with the back flush cannula like shaking around them, the bleeding is removed, and now there is no traction there anymore. You see a retinal membrane over there at the macular area, and still some epiretinal hyaloid, as you see here. I'm grabbing the whole thing, and the hyaloid is being removed with a very high speed cutting. This is very interesting to do. You've left some of the retinal hemorrhage there from the new vessels present. And now still removing all these pre-retinal tissue. And now, as we removed everything, it's time to use what? The perfluorocarbon liquid. It is very important to pour the perfluorocarbon liquid very slowly. You want this single bubble, of course. Sometimes it goes with many bubbles, but then they call us. You gotta be patient. And after that, the surface tension from the perfluorocarbon liquid halts the bleeding, so you don't see bleeding anymore. You might see this bleeding when you remove it, but at this point, with the controlled intraocular pressure, and also the action of the peripheral carbon liquid. So everything seems very calm. It's time for laser. So laser is performed, as you see here, in a photocoagulation fashion from peripheral to central. Of course, avoiding the lens and removing all peripheral carbon liquid. As I said, you still have some retinal blood coming from these new vessels, but of course, after the air fluid exchange, that's going to be next, and after you inject gas inside the eye and keep the patient in the face down positioning to avoid, of course, the cataract, and also to halt these new vessels from bleeding. They are going to just shrink, because now you've got enough laser. As you see here, you see some, the laser all over. A good photocoagulation, lens is clear, removing the sclerotomies, and that's about it. Thanks a lot for your attention.